everybody. Welcome to the basics class. Thank you for coming. We're going to talk about, all things kidney disease. We're going to talk about we have some blood values to learn. We have Dr. Prince here. He's supervising the class. If you guys have any hardball questions to throw out at me and I can't answer, he's available. Okay. My name is Colette Boroch. I'm the lead care manager here. And we'll get going. Okay. Okay, so I like to start out with some frequently asked questions. Of course, I do encourage you guys to, get as much out of this class as possible. Okay, so if you have any questions, feel free to reach out, but we'll go through these really quick. One of them being, since everyone loses kidney function as they get older, how do I know what is normal for me? So we're going to clear this up today. I have a formula that, they do use. They take in consideration a couple of things like your age, your sex, your race, how much you weigh. And that all has to do with what your actual kidney function should be. Okay. And then of course it does drop a little bit more if you have kidney disease. Okay. Is kidney function different for males and females? Yes, it is. Basically because females and males, they have different body structures, muscle mass, different things do take into consideration the amount of kidney function per the different sex. And that's why they use the sex in calculating your normal kidney function. Then our third one, does one of my kidneys work well and the other one not work? Most of the time, no. If you think about it, if you have diabetes or high blood pressure, it's attacking both of your kidneys at the same time. Okay. The only way to find out if you do have a specific condition that's only, attacking one kidney, or if there is some, genetic predisposition, you would have to get a kidney biopsy and then they would find that out. Okay. All right, so this slide is just pointing out that there are more than 1 in 7 adults that are estimated to have chronic kidney disease. So just pointing out here, you guys aren't alone. I know, this class, I do like that it's a group so that you could see some of your peers here that are going through the disease and different decisions they have to make. It is a pretty popular condition, unfortunately. Okay. So why are we here today? Well, your doctors definitely want you to learn more about your disease to make more informed choices, okay? We want you guys to know more about slowing down the progression of the disease to have the best quality of life possible, all right? There may be some physical, emotional, financial changes ahead in any chronic condition as it does progress. So it's better to learn about it ahead of time, just to be, prepared to see what you may come up against in the future. So today, we're going to learn about the different stages of kidney disease, what you can do to help. This is the most important part, I would say, just to try to slow this progression of your disease and how you can have a hand in that. I think that's always important. And then again, like I said, what to expect. So we'll go through the different stages, what to expect at the later stages. Okay. Now we'll start at the basics. What do our kidneys do? They have a lot of different jobs, all right? Many of us know already that they do remove waste products. That is the most obvious job that our kidneys do have. But they also play a part in balancing fluids within the bodies. They do rid of fluids. They help control blood pressure. That's why sometimes if you have kidney disease, your blood pressure might be a little bit high. Some of the hormones come into play there. That brings us into hormone regulation. The kidneys do regulate specific hormones as well. They also keep bones healthy. They balance specific minerals in the body. They rid, excess waste through excess minerals in the body. And they also help make red blood cells. So they do a lot. Okay. We'll talk about, you know, what at the later stages, how the kidney disease does affect these main processes. Okay, what is chronic kidney disease? Keep in mind, chronic kidney disease, it's something that happens over time. Does not happen overnight, all right? So this is where, you know, stepping in and slowing the progression yourself is key. It's very important to understand that. But as we just described, all of the jobs of our kidneys, over time, your kidneys do lose this ability to filter the blood as well as they used to. So all those jobs, they start to get a little bit weakened, or they're not able to keep up with those jobs as much as they used to. All right, so we'll talk about CKD risk factors. Usually by now you've seen your nephrologist already. I know you guys are all coming from your kidney doctor. So, but your primary care doctor usually screens you to see if you have any risks for chronic kidney disease, especially if it comes up in your blood work, something's a little off. But just so you're all aware, the risk factors are age. Your kidneys do lose function no matter what as you age either way. Okay, but we have diabetes. This is one of the #1 causes of kidney disease. High blood pressure does affect the kidneys. It does damage the kidneys over time. A high BMI, so that's your weight. You want to make sure the weight is low, but also a family history of chronic kidney disease or your race has to come into play. Okay, so as you can see, we have 2 different colors here on the board with their risk factors. Can you guys tell what the difference is between the orange and the blue?
One you can do something about, the other you can't.
Exactly. That's exactly what I was looking for. The orange ones here, diabetes, high blood pressure, high BMI, they're modifiable. So you're able to have some control over these things and the choices you make with if you're taking medication, your medication compliance, your diet can have a play in how these things are controlled. So these are things that we're going to definitely focus on. Of course, not everybody here is going to have each and every one of these things, but we'll go through some other modifiable things you can do to help yourself. Unfortunately, we can't do anything about how old we are, our family history, or our race. So we'll focus on the other ones. Okay, how is chronic kidney disease diagnosed? There's usually 2 main tests that they look for, and your nephrologist probably take these tests on you pretty often when you go to the doctor. It's the urine test looking for protein or albumin in the urine. So usually they take, you know, a urine total protein. If the protein is high in the urine, that is an indication of chronic kidney disease. All right. And then we have our blood creatinine test, which I hope you guys all know about. Usually this is what they point out to you at the doctor's office when you're seeing your nephrologist. The creatinine, this is another thing that's used to estimate your GFR or your kidney filtration rate. Okay. Other tests may be needed just to find out if you have underlying factors or if, you know, certain functions are being messed up by the lack of kidney function. So sometimes they need to check your anemia, your blood count levels, any phosphorus levels, things like that. And then, of course, further urine studies as well, and radiology studies. If, you know, they want to take a look at your kidneys, see if you have any cysts, things like that. That's all up to your nephrologist's discretion. Okay, so this is a big word here, but it's a very important blood test that you guys need to know about as well. It's more important than your creatinine. This is your GFR. That's what you'll see on the actual blood test, okay? It stands for glomerular filtration rate, which is also your kidney filtration rate. Okay, I like to think of it as a percentage. So a normal would be 90% or higher. So 100% perfect kidney function, right? This is the number that best helps your healthcare professional to know where you are in your kidney disease stage and to know how well your kidneys are working. Again, it's a percentage. So no matter what, like I said, it does get lower with age. But it also can get lower as kidney disease gets worse. So you want it to be as slow as a decline as possible. And then again, as I said, it does help determine what stage of kidney disease you're in. All right, we have a couple of formulas here. I don't want you to get too caught up in this because this is a little bit complicated, but they're just pointing out what is used when calculating this percentage of kidney function, okay, specific to you. So in one of the formulas, they take your creatinine clearance, that is the closest estimation of your GFR. What's taken into consideration is your age, your weight, your creatinine number, and your sex. Okay. Then we have the bottom study equation. This is the blood, which is the what you see in your normal BMP or your basic metabolic, what they draw on you every time you go to the doctor's office. So they take, again, your creatinine, your age, your sex, and also your race. So you'll see there's two different numbers for the GFR. They say if African American or just plain, because it is a little bit different based off of the race. Just a little FYI. All right, so we'll go through the stages. I think this is a very important slide that, you know, if you take anything home, I think this is printed out on your handouts that we gave you in these folders today. So we have stage 1 and 2. This is pretty much, you're not even seeing a nephrologist at this point. Okay. Chronic kidney disease is staged a little bit differently. So 1 and 2, you really don't even have an effect. All right. You're not having any symptoms. There might be a slight decrease in your kidney filtration rate, but you know, you might have a little bit of protein in the urine or whatnot, but you don't really see a nephrologist until you get into about stage 3. So that's when your kidney filtration rate falls below 59%. Okay. This is considered a moderate decrease in GFR. They did split this in half. In the first stage, again, you're not going to see any symptoms, but you might want to, again, get your blood work done a little bit more regularly than you would if you were not in stage 3 yet. Stage 3B, again, you might have to get your blood work done a little bit more often. They might want to keep an eye on it, but you're really not seeing any symptoms until about stage 4. So stage 4 is when the GFR falls below 29%. This is considered a severe decrease in the GFR. And this is where some complications might come up. You might have some anemia, your potassium might need to be regulated, things like that. You might have to take a little bit more medications for your conditions at this time. You're probably seeing your nephrologist more often at this point. If you're not seeing them every 3 months, definitely close to that, because they really want to keep an eye on these numbers.
I'm moving next door to him.
Gotcha. I mean, whatever you gotta do. If he's pulling you in every week, yeah, it could be, you know, due to your symptoms, right? Like if you have anemia, if you have high potassium.
No, you won't feel that for 3 months.
No.
He's just kidding.
Okay. And then we have stage 5, which your kidney filtration rate below 15%. At this point, it's considered renal failure. So these two last stages, 4 and 5, are the most important stages. We are definitely trying to have a better initiative here at PRINE with patient education. We are trying to get our stage 4 patients a little bit educated on choices that they may need to make before they end up in stage 5. Because then at that point, it could be an emergent decision and you get some choices taken away. So just trying to prepare a little bit better. You could be at stage 4 for a long time, okay? But just being aware and just, getting that mentality digested that you may have to make some choices in the future is always a good idea.
What do you mean by long time?
So some patients can be in stage 4 for a couple of years. Okay. No, it's different with everybody. The stages change, just so you know, on the basis of evidence. Like your labs are different or in this range for more than 3 months. So they have to be stable at, below 29 for more than 3 months. And your creatinine numbers need to be stable, all of that, for it to be an actual diagnosis of stage 4, or if you're moving to stage 5. You can teeter sometimes if you're dehydrated or if something happens, if you have to get contrast dye or something and it rises your creatinine and lowers the GFR level, it could be considered an injury, but they might be able to bring it back up in the hospital so that you're not considered stage 5 because it hasn't been stable for 3 months, just so you know. So again, it is a time consideration when moving from the different stages. People stay in stage 3 for years and years. And again, I think definitely having the mentality that you have some control over it with your diet, exercise, controlling your other conditions like your blood pressure and diabetes, it definitely will slow and keep you in the different stages for longer. All right. Any other questions with the stages? All right. So we have our GFR calculator here, but basically I have side by side here 2 completely different types of patients. All right, I have on our left side, and they have the same creatinine, just for a comparison.
Okay.
So on the left side, we have a serum creatinine of 1.4, but this patient is an 80-year-old female that is 5 foot and 100 pounds. And then we see if we plug in all those numbers, her GFR result is 28. Okay. On the other hand, to contrast, we have a 200-pound, 6 foot tall, 18-year-old black bodybuilder with a creatinine of 1.4. Now we could see, plug into our calculation, his GFR is 102. You see the difference, and do we notice what stage both of our patients are at?
What age is the second one?
Our second patient here is 18 years old.
18, and the other one is 80?
Yes. So definitely just highlighting here that there is a difference in the numbers, and this is why they take into consideration, your sex, your age, your race, and your weight. So I know a lot of you guys are familiar with the creatinine number. A lot of times your nephrologist does focus on that, but that is not the most important number in kidney disease. Because look, they have the same creatinine and their stages are completely different. We have our patient here on the left. She's in stage 4 with a 28% kidney function. And then our patient here on the right, he's perfectly fine, 102% function. Not even in a stage at this point. Okay.
So age makes a big difference.
Yes, exactly. So just some important takeaways here, just understanding what your GFR is. So maybe a little homework for you guys to figure this out before you go see your nephrologist, right? And then understanding what your CKD stage is. Okay, so moving on, now we'll talk about what you guys can do. All right, some general strategies to protect your kidneys. We have our graph here. Okay, so we'll talk about this. This is just showing the decline of kidney filtration rate, or your GFR decline. No matter what, at the top here, you will be losing 1 ml per minute per year, starting at age 45. Okay. If you have kidney disease, there's more pressure on it. It'll drop a little bit more. And then I'm using, this isn't like exact what's going on in this chart, but just for example, say you have kidney disease, but you have uncontrolled diabetes on top of it. It's going to drop a little bit more per year. Add blood pressure onto that. It's dropping even more. Add uncontrolled diet and high BMI. It's going to drop even more. So what is the goal here? You want to try to decrease this line as much as possible. How? If you just drop a couple pounds, get your BMI to a more healthy level. This takes some pressure off. You're going to go back up. Control your diabetes, make sure you're following up with your endocrinologist, taking your insulin, following through with the dietary precautions, making sure your blood pressure is okay. Make sure you're taking your medication, staying away from sodium, things like that. Quitting smoking will definitely take the pressure off as well. So again, things that you can control to try to flatten this curve, so to speak, as much as possible. Another thing you can do is to avoid the nephrotoxins. So big ones are NSAIDs. I'm sure your nephrologist has mentioned it. But just a couple of examples, ibuprofen, such as Motrin and Advil. Those are popular NSAIDs. They're non-steroidal anti-inflammatory medications.
Absolutely, that's what caused my kidney, the Motrin.
Really?
Yes, the
Gotcha.
Motrin and another
A combo.
medication.
Yeah. Yep. Unfortunately, I wish they taught you this right out of high school, right? Protect your kidneys, try to stay healthy. It is no joke. You definitely don't want to abuse these things. And then,
Because it happened suddenly.
yeah.
It wasn't, had no problem.
Gotcha. Yep. And we'll talk about this again at the end of the slide, but it's very important just to let your doctor know exactly what you're taking, because there are some contraindications if you're taking 2 medications. It could affect your kidneys as well. IV contrast for a CAT scan. This is important to know. Based off of your kidney numbers, sometimes they'll ask that you get the CAT scan done without contrast dye, because this can hike up your creatinine, the contrast dye. Certain antibiotics. This is why it is important, if you're seeing just any urgent care, or your primary care should know each and every of your diagnosis. Okay, it's always good to keep communicating between your providers, even if you bring blood work places, just so they can see what your kidney numbers are, so that they're careful in what they're prescribing you for if you have an infection. Okay, certain herbs and supplements as well could affect your kidneys. And going back to whatever you're taking, even if it's a vitamin or an herb that you're taking, right? Just bring it up to your nephrologist at your routine visits. If it's something that you're taking daily, or, I would say more than 3 times a week, definitely just make sure it's okay. They'll be more than happy to answer your questions. Okay, definitely wanted to emphasize the importance on physical activity as well. This is definitely good just to, of course, increase your strength. It does lower your blood pressure, build your bone strength. Sometimes as your kidney disease declines a little bit, you may come into some bone issues. I won't go into the specifics of that, but this is a good way to help counteract that. You can improve your weight control if you need, to bring down the BMI, of course. Exercise does lower cholesterol. If you do have high cholesterol levels, this can put a strain on your kidneys as well and your heart. And then overall, it will make you feel a little better, even if it's just walking for 30 minutes a day, whatever you can do. We would strongly encourage that. Okay, so now we're kind of transitioning into our important stages. We'll talk about a little bit more of the details of what happens at each stage. So we'll talk about stage 4 right now, and then we'll hop into 5. So here we have stage 4. Remember, that's when your GFR falls below 29% for more than 3 months. Okay. The goals of treatment would be to, of course, slow the loss of your kidney function and handle the problems of chronic kidney. As I said, this is when you may come into complications. Okay. You're going to want to learn about what you can do to keep chronic kidney disease from getting worse, and to do it. Actually try and see, what you can do for your health. At this point, again, you want to start learning about options for treatment for kidney failure so that you're prepared to choose the one that's best for you. Okay, this is where you have the best chance before you might have some choices taken away from you if you have to start emergently down the line. Here's an example of something you could do to keep from your kidney disease from getting worse and sticking to it. If you smoke, quit. Okay, again, we talked about our modifiable risk factors earlier that we had in orange: our diabetes, high blood pressure, and BMI. I just answered my own question for you guys. Sorry about that. Okay, so your overall plan of care or plan of action, just so you know, you are going to be working with your healthcare team, your provider, if you have a care manager here with PRINE, to figure out a plan that can help you overall keep your blood pressure and diabetes well controlled. This is very important. If you're on medication, sticking to it, being compliant. We do have blood pressure monitoring here as a program, but it's very encouraged just to monitor your blood pressure at home, no matter what. Take it once a week, see where you're at, make sure that your medication's working. Diabetes as well. It's a little bit more strict in diabetes. If you're taking insulin, you need to be taking that finger stick about 3 times a day, either way. Okay. Lower high cholesterol levels. Again, I did mention earlier, high cholesterol levels can weigh down on the kidneys and your heart. So it's very important to keep those controls for your overall health. Managing anemia. Anemia is it's a popular complication in later stage kidney disease. As we brought up, in our kidneys' main functions, they do regulate hormones that promote red blood cell production. So once that starts to slow down, your hemoglobin numbers might drop a little bit, or your iron might drop a little bit. You might need some supplements for that. Prevent or lower risk of mineral and bone problems. Yes, again, going back to our main functions, the kidneys do help keep your bones healthy. Sometimes if they're not regulating the amount of phosphorus, this can kind of affect your bones and leach out some of the calcium in there, causing weak bones.
You can't replace the calcium with supplement?
You can, and this is a very specific condition to each and everybody, where if the nephrologist sees this in your blood results, they'll definitely speak with you.
Okay.
So all of this is treatable, but you want to keep on top of it. Make sure you're getting your blood work checked and sticking to the recommendations.
Hormones.
The hormones.
Is there a way of adding certain hormones to help the kidney?
Yep. So with anemia, especially, there is a hormone injection that they may have to give you to boost your blood cells. A lot of patients in late stage end up having to get this hormone.
Oh,
Mhm.
all right.
Yes.
What about your fluids?
Fluids,
Retention of fluids?
yeah, so in late stage kidney disease, it is popular that you may have the fluid retention. It does come with edema, where you'll see swelling in your hands, your feet, your legs, things like that. Salt has a lot of play in here. You want to definitely limit the sodium content because your kidneys are slower at this point. They're not getting rid of the fluid as quickly. So there is a risk of that fluid building up. Some patients are on diuretics, which the water pills help get rid of the excess fluid,
But at the same time,
which could
Dehydrates
also,
the
I
kidney.
know, it can also affect the
Balance.
kidneys in a negative way.
Mhm.
So if you are on diuretics, I'm sure your doctor is making sure they're checking your blood work pretty regularly,
Mhm.
making sure that it's not affecting any other levels. If it is, they have to dial back and kind of adjust things.
There is a device now that been introduced to monitor your fluids.
Okay,
That can be.
is that the cardio MEMS?
Yes.
Yes,
Yes.
yep, you're right. So especially in CHF or congestive heart failure,
Mhm.
your cardiologist might recommend that. That's getting very popular. So it'll tell you right away if you're
Besides weighing
retaining.
yourself every day.
Exactly.
You can do that, yeah.
Yeah,
Mhm.
yep. So, or sometimes the doctor will put you on a fluid restriction as well. So it depends. You definitely want to stay on top of preventing or managing malnutrition. Sometimes later stages, you have to avoid a lot of things. We do have a nutrition class if you guys are interested that we go into these things, but sometimes you're lowering protein, potassium, phosphorus, lowering your fluid intake if needed. So definitely see a dietitian helping out with this, what you can eat, focus on that. And then preventing or managing depression. Overall, these goals will help you slow the loss of your kidney function. All right, here is a little tidbit into the diet and fluid restrictions. We kind of just spoke about it, so I'll just reiterate real quick. Again, while your kidneys are starting to slow down, you would want to prevent buildup of harmful waste products and extra fluid that your kidneys may not be able to break down as much as they used to or regulate, get rid of. So specific dietary changes, we just touched on them. Sodium, you want to limit protein. Carbohydrates are important, especially if you're diabetic. Just knowing the best types of carbohydrates to have. You don't want to be malnutrition though. So definitely having that balance, knowing how much carbohydrates to have, the better ones. Fat,
It is the number of the carbohydrates or the type of carbohydrates?
it's both.
Mhm.
I think both are very important. So if you're interested.
You have a picture of beans. Are you allowed to have beans?
That's my ironic picture because there's kidney beans in there. That doesn't really have anything to do with,
No.
yeah.
Okay.
Because again, towards the end, there's different amounts of potassium, phosphorus, and all these things in a lot of foods, which you'll learn about. But yes, moving on, fat, you would want to have some control over to control the cholesterol levels, fluids, potassium, and phosphorus. These are all things we just, again, made a new nutrition class that breaks down each and every one of these bullet points, which is very interesting if you guys are interested in. Okay, medications, just so you're aware, this is where you may have to start taking some medications to supplement your insufficiencies towards the later stage kidney disease. The goals of taking these medications would be to balance vitamins and minerals as your kidneys are unable to. Control high blood pressure, of course, control cholesterol, treat anemia. We touched on that. Sometimes you may have to get that hormone injection. Treat high acid levels in the blood. And also, so sometimes your doctor might put you on sodium bicarbonate.
Oh, yeah.
This helps the uremia.
Oh, okay.
Yeah, it helps keep that acidity down.
So alkaline is better. Is that what you're saying?
There's a sweet spot.
There's a middle.
There's a sweet
balance.
spot. So you can always check on your blood tests and it'll show you the range. There's a sweet spot for all of these different levels that, you know, if it goes too high, your nephrologist is gonna wanna bring that down. Okay. And then, yes, medications to keep bone strong and prevent bone disease. We'll touch on this. This is very important just to be aware of depression in chronic kidney disease. This affects many people in CKD, okay? It affects many people with chronic conditions in general. It's a change and it's something that you're dealing with day in and day out. It can affect everybody in different ways, but we just definitely, you know, want to shed some awareness on watching out for these things. So if you're having any sadness, irritability, crying more than usual, less interest in things is that you used to enjoy, a loss of appetite, thoughts of giving up or feeling overwhelmed, these are all things that should not be bypassed. They can be treated. And it's important that, you know, you talk about it and not be ashamed of it because it's very, very prevalent in chronic kidney disease.
How can they usually be treated?
Treatment, you know, there's talk therapy, that's usually the first. If it's very overwhelming, some patients have to start a medication and they kind of titrate up from there. So it is something that, you know, definitely should not be thrown underneath the mat because you want to be able to take care of yourself. Unfortunately, with depression, it's a sickness where you're not as capable to, again, stick to your modifiable risk factors and get yourself the best quality of life. So I'd like to say that everything is important in taking care of chronic conditions.
Right.
Okay, so we'll start talking about stage 5 now, kidney failure, what happens. Despite the best treatment and your best efforts, unfortunately, kidneys can still fail. This is when 85 to 90% of your kidney function is gone, okay? Again, reiterating, your GFR level is below 15. The treatments include, which we do have more education on, transplant, peritoneal dialysis, hemodialysis, and medical management. So if you guys are signed up for our choices classes, they're split in 2. This is what we talk about at those classes.
You explain that.
Yep, we go into the details of all these things and medical management and the importance of advanced directives. Some stage 5 symptoms. I like to say definitely keep this with a grain of salt. These are things that happen late stage 5. Like you actually want to avoid this. But at the end of your condition, you will be seeing your nephrologist pretty often. Sometimes patients even come check their blood work once a week, but your doctor will definitely see you more regularly based off of your blood results and the amount of symptoms and the severity of your symptoms. This is where it is the time to start dialysis or, you know, start the treatment for your renal replacement. Okay,
A lot of these things can occur for other reasons.
Yes.
Right.
exactly. So that's why I'm
You have
saying,
to be-
take this with a
yeah.
grain of salt.
Mhm.
I like this because it gives you things to look out for if you're late stage, but I
Mhm.
don't like it because anybody could have nausea, anybody could have swelling or
Sleeping.
Right, trouble
cramping,
sleeping.
Yeah.
troubles, exactly.
Mhm.
So that's why I say this is very important to
Right.
understand. This is at the end, later stage 5. This, if you're having this in stage 3 or 4, you're not to worry that you're going into kidney failure. Okay,
You know your body. You know.
exactly. Listen to your body. You know, your doctor will be more on top of you at the end of your stage with your blood tests and asking you if you have these
My doctor's
symptoms.
wonderful. I have his.
I know, you have
his
said
private
Kate.
number, and I can text him anytime. Like,
Yeah.
if you're gonna take a medication or a supplement, I can text him right away, and he texts me right back.
That's great.
Yeah,
Because, this is the thing, you don't see the doctor for a while.
Right.
And you don't know what to do in between.
yeah,
I mean, that should be,
yep,
a
the
thing.
communication, and
mhm,
sometimes it's hard to get on the phone, so
Yeah.
I like the portal
mhm,
too. We have that where
Right.
you could text in a
right,
message to your doctor just in between visits. So,
mhm.
and we have our care managers too, if you
Right.
have any questions, just to kind of get back to you quicker.
That's a good program. Nurses call you.
Mm-hmm.
Yes.
Yep. Yes, definitely. So we're at our end here. I'm gonna give you guys a quiz. Let's see how well I did and how well you guys listened. Okay,
Go ahead.
this is true or false. Number 1, your kidney's only job is to remove waste and extra fluid from your body.
True.
False.
Well,
It is false. You came in a little late. We talked about this. They have a lot of different jobs. So from regulating hormone production, red blood cell control, blood pressure control, they regulate fluids. They do a lot of things. And that's why it's important that you understand what can happen as your kidney function gets worse and your body needs a little extra help in these areas.
Okay.
2, people with diabetes or high blood pressure have a higher risk of getting chronic kidney disease.
true.
True, exactly. We did touch on those as a risk factor. 3, people with early chronic kidney disease always have a lot of symptoms.
False.
False.
Correct, exactly. You don't really see a doctor until stage 3 and symptoms don't come out until about stage 4.
I feel fine.
Mm,
Gotcha, yeah.
I
Yeah.
feel no symptoms.
Some
at
patients
all.
don't even have
So that's what's so weird.
Yeah, my
Symptoms.
suddenly, yeah.
That's why, patients can be in stage 4 and still not have any complications, and they're just in there for a while.
Mhm.
So everybody's different. Number 4, early detection and treatment can often keep chronic kidney disease from getting worse.
True.
True.
True, exactly, as with all things. The earlier that you catch it, the earlier you do interventions, you have a higher chance of slowing the progression. Number 5, protein in the urine for several weeks can be a sign of chronic kidney disease.
True.
True, yes, exactly. That was back where we were talking about our lab results. They do, test you for protein in the urine. If it's pretty high, you will be indicated for chronic kidney disease. Number 6, the best way to know how your kidneys are working is to know your glomerular filtration rate or your GFR.
True.
True.
Exactly, yes. And then 7, anemia and bone disease are common complications of chronic kidney disease in later stages.
True.
True.
Yes, look at that. Well, as a group, I think you all did great. Thank you very much. So we're
We've
at the
been
end.
at it a while.
I know. But I definitely commend you guys for coming today.